I'm Sana Khan and you're watching Medicircle. Today we have a very interesting personality with us. He is an NABH assessor, a speaker, thinker, and an innovator. He has experience in healthcare for more than a decade now. He is currently working with QRG Central Hospital and Research Center as a unit head. He has previously worked with Fortis Healthcare as facility director and Park Group of Hospitals in Faridabad, Manipal Vedic Life Care Hospital in Nigeria, Healthcare Department with Haryana State Government, PGIMS Rohtak. Please welcome Dr. Manjinder Bhatti to our show, Dr. Speak. Hi, Dr. Manjinder, how are you?
Hello, I'm good.
Okay, to start with, um, you are a doctor, NABH assessor, speaker, thinker, and an innovator. Which role do you enjoy and why?
See, it's more of a mixed bag, but then being a doctor, it's always, the role of a doctor is always dear to my heart. It helps us in, serving the community and making the healthcare system, more safe and quality driven. Well said about that. I would also add, in today's era, we need to have a focus on quality-driven, evidence-based healthcare systems. And we need to have a transparency in the system. We need to have certain standards and benchmarks which are internationally recognized and are responsible for the best outcomes for the patient. And there is where the role of an NABH and JCI and all these accreditation bodies come in. And I feel really, enriching experience visiting various hospitals as an NABH assessor. And, even now with the vast reach of NABH, even the small healthcare organizations, small clinics, small eye care centers are, going for the buzzword called quality and guiding them in their journey to achieve excellence. It's also a very cherishing experience, no doubt. Uh, Talking about the innovation part, see, today's healthcare scenario is transformed immensely. There is a huge lot of cost involved in today's healthcare scenario. There's a capital investments, there are infrastructural costs, the skilled labor availability is a challenge. And in such a scenario, we need to be innovative. We need to have a system. We need to have innovations, which help us to counter all these effects. And especially, to nowadays, most of the hospitals are going for green hospital, greener infrastructure. We are moving toward greener OTs. We are doing for water harvestings. We are using electrical equipment which are more energy efficient. So innovation is another important aspect of the entire healthcare scenario, in my understanding, right? And of course, if you have all that knowledge and if you have all that experiences, you need to share it, and you share it when you speak your mind out. So I feel that if I summarize it, I would say that as a core of being a doctor and a management professor, I'm enjoying all my avatars of thinker, innovator, speaker, and assessor.
You have served at primary, secondary, as well as tertiary health organizations. What changes, according to you, need to be made so as to make healthcare affordable and accessible to each citizen in India?
Right. So I started my career with a primary healthcare system where I was serving with the government, and then I moved on and moved on to corporate sector. I also did certain projects with the trust hospitals, and whatever said and done, we need to understand that this pyramid of healthcare ecosystem, at the base we have the primary healthcare, and as we proceed, the secondary healthcare, and finally it narrows down at the top of the pyramid with the tertiary advanced healthcare. So, and this current pandemic situation has really, made us think more of our primary healthcare system. So, we need to strengthen our primary healthcare system, no doubt. We have a mortality rate in India of 7.3%. We
Right.
have a billion plus population, and to reach out with advanced services to these such a large chunk of population is a very big challenge. So we should our focus should be on the primary care, with respect to prevention and screening of vast population, and to reach out to this primary level. There is a divide between rural India and the urban India, so we need to bridge that. And these primary connects in terms of primary health sectors, in terms of more and more healthcare doctors, general practitioners at the primary level, would be one answer, to reach out and make the cost effectivity of the healthcare scenario. However, to achieve it, we need to have obviously more and more of a medical infrastructure. We need to have more of medical colleges to produce more of doctors. Then we need to have various nursing academies, nursing zones, which can bring us the skilled labor. And ultimately, once we have the infrastructure and manpower in place, then we need to have to make it affordable. We need to, provide certain kind of insurance or certain kind of optimized treatment, optimized cost options to the people of India, right? And here comes the what very important role of a sector in healthcare, which is growing vast, is the insurance sector. We need to work out all the insurance policies or insurance schemes which are more affordable for the majority of people. And then, of course, there are certain ambitious programs that have been carried forward by the government in terms of Ayushman Bharat. So, and it has definitely and drastically, widened the base of healthcare to reach out to the rural India. But again, the cost effectivity and the optimization of costs need to be done, so that more and more of a private player and corporate, hospitals also join these schemes of the government, so that they are more fruitful for the majority of our population.
You've concluded various case studies and projects with organizations like Christian Medical College, Max Hospital Mohali, MGM Hospital Vashi, and Alchemist Hospital, and were engaged with the healthcare department of Haryana government, where you executed clinical and administrative work with proficiency. Also, you have been appreciated by government for extraordinary performance during flood situation and are certified Six Sigma Green Belt by PPDC, Agra. What drives your motivation?
My parents, have always been a source of my inspiration. And apart from that, I've been loving to learn out new things, reach out to new people. And there is, I firmly believe that you have to continuously evolve yourself. You have a continuous desire to, change yourself, bring out change within yourself. And each one of these organizations, maybe it were certain projects with the trust hospitals like CMC Ludhiana, or with the government setups, they were very challenging, no doubt about that. And I'm talking about 20 years back when I joined the government service. So it was more of a resource crunch in that particular system. There was the infrastructure part was somewhere lacking, which is still a great thing need to be done in the government sector in terms of infrastructure. uh, and again, it was not a very attractive sector for the highly skilled doctors. Getting a super specialist and specialist, was not an easy job at that time. But then again, that experience, gave us how do we get the best out of what we have. So, for an example, working in a, there were flood situations in Ambala. I think it was, don't remember the year exactly, and the entire, the highway connectivity of the city was totally blocked, and there was a public was there was a huge hue and cry, and we were like, how do provide healthcare service to people at the same time? Once the water recedes, there are chances of an epidemic. So I could see, how we utilize the government buildings or the religious buildings. We utilize them. Temporarily, we connected, erected the command centers over there. We had life-saving boats in which we were distributing medicines to different people across the city. So it was really challenging. But then again, at the end of the day, when you get people rolling out, when you get the things rolling out, and finally the flood situation was controlled. So it gives you a lot of motivation. You see people, and when government comes out and gives you and appreciate you for your efforts, it's really motivating. And finally, even in the corporate world today, I see patients. Recently we had a baby who was a 25-week born baby, premature, and she spent around 2 months with us. Our pediatrics team, did a wonderful job. And yesterday only, the baby was discharged and was going home. And the parents were like all smiles and all, they have all the appreciation for all this stuff. So that's these things really motivate us.
Okay. What is the effect of COVID-19 on the healthcare system, according to you?
It's all around the news channels now, and obviously it's one of the worst time the humanity, has seen. In the though there have been studies which say that every 100 years there is certain epidemics. Maybe it is Spanish flu, maybe it is plague or anything. All these things come, but yes, for our generation, for us, it is a very, very unprecedented condition, and it has impacted the entire world, in a manner which no one anticipated. The economy is jeopardized. The entire, not only the healthcare sector, the entire economy, the entire social fabric, has been impacted by the COVID-19. We can't avoid that. But then again, there are learnings that we have got from this. Until the vaccine comes, which nobody knows when it's going to be out, but at the same time, it's given us the learning about how the primary care is still important, how the simple hand hygiene is, social distancing, and can help us to tackle these kind of infectious diseases. So, and but then again, it's a very grim situation when we saw the images of the most developed countries like US, UK, they're struggling for beds. Beds were not available, and people were, like the mortality was going really high, and I mean that was a really grim situation. Uh, I would say, in terms of India, yes, the government took timely measures. Certain measures were taken. A lot of awareness was spread out, and the most important thing that as a nation, which I feel as a doctor came up good for us, was that this concept of Atmanirbhar. What I could see initially when the pandemic was striking us hard. At that time, the cost of healthcare was going out of, it was spiraling like anything. And there was a shortage of PPEs, there was shortage of ventilators, there was shortage of all the biomedical equipment. And then there came this concept, and we started developing, various indigenous ventilators, BiPAP, PPE kits. The PPE kits, which were, at the starting of pandemic, so cost so high. Today they are available. Quality PPEs are available at affordable price. So this is something which is, I would say, the silver lining of the cloud. One, that we have learned that the primary healthcare is of utmost importance, and two, yes, as an India, as a nation, our dependence on various advanced countries, developed nations, can be curbed down once we, go for indigenous productions. And finally, it is, it's a ancient, age-old saying that prevention is always better than cure.
Thank you so much, Dr. Manjinder, for coming to our show and giving us your valuable insights. It was a pleasure having you on our Medicircle platform.
Thank you, and I must say that Medicircle is also doing a great job. You guys are reaching out to, across the globe with all the, latest updates on medical circles. I really appreciate the good work going on. Keep it up.
Thank you so much. Thank you, Doctor.
Thank you.
Have a
Thank
good
you.